What I always recommend that my patients be on, I put them on the anti-inflammatory diet. And this is an important part of the healing and repair process, and it's critical for optimal results. If you continue to put foods in your body every day that have an inflammatory response, we will not be able to start the repair that's damaged to your body and your brain. Just as if a building had burned down from a fire, the construction workers cannot begin to rebuild the building until the fire were to be put out. So an excellent example of this anti-inflammatory diet has been referred to as a ketogenic Mediterranean diet, which is not the typical high-fat ketogenic diet, and instead includes MCT, or coconut oil, moderate red wine, green vegetables and salads, fish as your primary protein, as well as lean meats, fowl, and eggs. Evidently absent from this diet are sugar, refined grains, whole grains, and legumes, which are overtly inflammatory in the case of refined carbohydrates, and not nearly as nutrient-dense per calorie as vegetables and fruit, which are the case for grains and legumes. So basically, as the anti-inflammatory diet excludes gluten, due to the avoidance of wheat, rye, and barley, many conditions can be avoided, such as asthma, schizophrenia, autoimmune diseases, and even cancer. So basically, what all this means is that when patients with metabolic syndrome adopt the ketogenic Mediterranean diet for 12 weeks, there were significant reductions in chronic systemic inflammation, 100% resolution of metabolic syndrome, and a reduction or resolution of non-alcoholic fatty liver disease. So this dietary approach is directly relevant to patient wellness, as approximately 25% of patients do have metabolic syndrome, and these patients are more likely to express what we call musculoskeletal pain syndromes. So I recommend that for the duration of their care that all my patients be put on the anti-inflammatory diet in order for them to feel better.